Hello, my name is Malay Shah, and I am a senior at Hightower High School, where I am a part of the Medical Science Academy. Today, I will be presenting on access to care in Fort Bend County. I conducted my research project at Access Health. It is a community health center for the underinsured, where they provide health care for the underprivileged population in Fort Bend. I was very grateful to see a less visible part of my community and see how I can serve them in the future as a physician. Alright, first I will be going over some background information, my reason for choosing the project, how I conducted the project, and what I learned. I will be starting off with some background research to help you understand the context of systemic issues in our society and the medical and societal processes that contribute to them. So, a little about metabolic syndrome. It is a collection of conditions including high blood pressure, obesity, type 2 diabetes, and abnormal blood lipid levels. Metabolic syndrome has been associated with an increased risk of cardiovascular disease. A study found that the disease became 35% more prevalent from 1980 to 2012 and is continuing to do so. This condition has disproportionately affected the Medicaid population and has caused preventable hospital visits and adverse health outcomes. There are more specific statistics on this slide regarding how many are hospitalized and the monetary cost of treatments. Another study concluded that interventions to manage chronic conditions like metabolic syndrome must be implemented to manage costs the Medicaid population faces. Next up, we have food deserts. They are defined as neighborhoods with limited or no access to affordable and nutritious food. These residents often end up resorting to unhealthy food options due to such a barrier. Furthermore, a lack of access to healthy food has an association with developing cardiovascular disease. As you can probably already see, this connects back to metabolic syndrome. Thus, the Medicaid population is one that often does not have access to healthy food and is likely to develop metabolic syndrome. Now, I'm going to talk about access to healthcare. Chronic conditions affect 77 million Americans and take up 71% of all healthcare dollars. This shows how big metabolic syndrome's impact on our healthcare system really is. A study found that many low-income patients do not have access to healthcare, and this often leads to metabolic syndrome not being treated at its earliest stages. One way that this issue can be addressed is by an expansion of community programs, like the one Access Health leads in Fort Bend County. The purpose of this study was to identify where Medicaid patients in Fort Bend County were at high risk to develop metabolic syndrome because of their lack of easy access to healthy foods and healthcare facilities. By extension, the goal was to find areas in Fort Bend that could be better served medically and otherwise. The reason I decided to do this project was because I was interested in finding out where in Fort Bend County Medicaid patients were likely to develop chronic conditions, like metabolic syndrome, because of their lack of access to nutritious food and healthcare. This would allow me to elucidate a direct link between social factors and illness. Next up, I will outline my methodology. For this study, I used two databases. One was the UDS mapper created by the Health Resources and Services Administration. I used it to identify where the Medicaid patients were located and some of their health conditions. The second database I used was the Food Access Research Atlas created by the U.S. Department of Agricultural Economic Research Service. This database helped me map the food deserts and see where they were located. I combined the data in these databases and created maps which will be shown in the coming slides. Now, I will go over my results as well as the maps I made of the disparities in our county. This map shows where patients who use Medicaid are in Fort Bend County. As you can see, 77485, 77489, and 77477 were the zip codes with the most Medicaid users, defined as more than 60%. My project focused on the Medicaid population since they are vulnerable to chronic conditions like metabolic syndrome. This map shows the Medicaid users in Fort Bend County who were not served by a health center, therefore underserved. I included the teal circles to show where Access Health clinics are since they are the dominant health center in Fort Bend County. The zip codes with largest underserved populations are listed. I also charted local hospitals. You can see that certain areas with more than 6,500 underserved patients have low access to healthcare. This map shows the adults in Fort Bend County that did not seek the care they wanted because of financial reasons. As I mentioned earlier, access to care is a probable predictor of metabolic syndrome, and this map shows where they are located. Here, some underserved areas have between 20 to 38% of episodes of medical reluctance. This map shows where 30 to 61% of adults do not have a usual source of care. These patients do not have routine checkups, so metabolic syndrome will most likely not be caught at its earliest stages. Seeing where these patients are is very helpful for understanding how to solve the issue. This map shows the zip codes with adults who were told they had diabetes. As I mentioned earlier, diabetes is one of the conditions under metabolic syndrome and can cause a variety of health complications. Here, we see some underserved areas with a prevalence of 20 to 44% of diabetes, an important public health concern. This map shows the zip codes with adults who were told they have hypertension. This is also another condition under metabolic syndrome. As you can see, many of these same zip codes are repeating. When it comes to presence of chronic conditions, some underserved areas have a prevalence of 45 to 75% of hypertension. This map shows the zip codes with adults who were diagnosed with obesity. Central obesity is considered the main predictor of metabolic syndrome and affects many patients in Fort Bend County. This condition affects 35 to 57% of people in certain parts of our county. Obesity remains a significant public health challenge. This final map shows the food deserts in Fort Bend County. The food deserts were defined to be urban areas farther than 1 mile from a supermarket or rural areas farther than 10 miles from a supermarket. Although there are not many areas classified as food deserts, this is an issue that must be addressed to keep our neighbors healthy. Zip codes at risk of low access to healthy foods are listed and seem to be associated with a variety of factors of interest. Now, I will go through my discussion and conclusion. This study found that the main zip codes in Fort Bend County that have patients vulnerable to metabolic syndrome are 77469, 77471, 77489, and 77477. All of these zip codes have areas that classify as food deserts because of a lack of access to supermarkets. This often leads to poor dietary choices and can lead to the development of metabolic syndrome. Furthermore, these zip codes, which are 77469 and 77489, have higher percentages of obesity. Obesity is one of the primary predictors of metabolic syndrome. Additionally, these 4 zip codes have high numbers, which were 6,501 to 13,000 Medicaid users who are not served by health centers. This means that they do not have access to routine checkups and other forms of health care necessary to improve and maintain health. A vulnerable patient's inability to receive care can lead to metabolic syndrome not being diagnosed early and prevent treatment. This study has identified the zip codes in Fort Bend County that have Medicaid users who are at risk of developing metabolic syndrome. This means that interventions targeting expanding access to healthcare facilities and nutritious foods must be implemented to provide equitable care to all patients. Additionally, educational programs must be developed to allow patients to make lifestyle changes to prevent the onset of metabolic syndrome. Also, this study has identified 2 possible environmental predictors of metabolic syndrome: patients living in food deserts and patients not having access to health centers. Currently, Access Health is working on expanding its services. They have implemented a program that provides their patients with fruit and vegetable prescriptions that can be redeemed at partnered pantries to promote higher quality diets. Additionally, Access Health is looking to provide healthcare to the underprivileged in all corners of Fort Bend County by continuing to serve the underinsured. In the future, I plan to compare the penetration rates of all health center programs in Fort Bend County to other districts, the state of Texas, and the United States, to see how our county can improve its services. Seeing how other health centers deal with access to care will be a great way to learn about and eventually develop new strategies for providing high-quality care. Here are my references. I want to thank Ms. Reed, Ms. Dillon, and Mr. Williams for their mentorship. I learned a lot that I can take moving forward as a pre-medical student. I definitely have plans to work with underserved patients in the future and feel more equipped to identify the barriers they face. Thank you for your attention. I hope you all learned something. I appreciate the opportunity to participate in GT mentorship and become involved in a project of this scope. I want to acknowledge Mrs. Bryant and my peers for making this year amazing and memorable.